All right. So one other just quick reminder, some housekeeping things. Uh, we will be sharing out the content of today's training or session. So we'll send out the slideshow. We'll send out any additional resources, as well as the link that you can watch again. All right. You're also welcome to share this with other independent providers. We'd love to have more people joining the community of practice to be able to ask questions and just help support each other. So, okay, I'm gonna put us in presentation mode here. All right. Okay, so again, thanks for joining us for the March session. It's kind of crazy that we're already here and the month is like going on halfway over. Um, Today's topic is training, renewals, and ongoing requirements specifically for independent providers. All right. And Anne, feel free to hop in wherever you'd like. I'll just kind of talk about this slide and then Anne will join in as well. All right. So staying compliant. So when we talk about our trainings, our certification, all those pieces and parts, those are the things that are going to keep us in compliance, right? So if you've had those compliance reviews, you've probably gone through somewhat of this process where you need to show your different trainings and certifications and things that you have done to keep your certification renewed. And so we just kind of want to talk through some of those pieces and parts and also provide you guys with some resources. So independent providers must maintain your DODD certification. So that's your certification directly through the Ohio Department of Developmental Disabilities. You have to maintain your Medicaid provider enrollment, required training, which we're going to talk about that a little bit more, the background checks, which is part of your initial background check that you send into the department when you get certified, and then documentation and billing compliance. All right, so we kind of just broke this down a little bit into the independent provider life cycle. So thinking of compliance in like 4 areas, if you will. So you have your certification through the Ohio Department of DD. You have your Medicaid enrollment, which is through ODM. The background check completion at the beginning of your certification, and then training and service requirements. So all 4 must remain active at the same time in order to continue to be, if you will, in compliance as an independent provider. All right, so independent provider certification. So when you're certified through DODD, some of the key points here is that your certification typically lasts 3 years. In progress. And with that 3-year cycle is generally when you're going to have a compliance review. So, if you're newly certified or if you've been certified for a while, your compliance review will typically be within that 3-year cycle. So if you had a review, let's say in May of 2022, I'm going to do my math really bad here. You probably would have had a review in 2025, but again, you're thinking of it in a 3-year cycle. Okay, renewals must be completed before expiration. That's a sticky point, right? So you guys are going to get a notification from DODD saying, hey, your certification's about to expire. I believe it's a 90-day time frame. Yeah, 90-day time frame that you're going to get that, reminder, and you want to stay on top of that as best as you're able, because if you hit or come to the expiration time frame, that's when things get dicey. So service specific certification applies, and then renewal completed through the DODD systems. If certification expires, certificate or services must stop. And Anne, you can talk about this piece a little bit more about how that happens if the expiration comes and passes. If you're within your 30 days of certification end date and you've not been recertified by DODD, um, if you've done your recertification recently, when we say the communicate box, it seems kind of simple, but there's literally a little box under your certification. Every page that you click on, that is your best and fastest way to communicate directly with the certification team at DODD. If you try to call or email them, they will actually tell you to go to the communicate button because you have direct contact now with who's reviewing your stuff, and they typically get back with you between 24 and 48 hours. You can request extensions, or if you have questions, it is your best line of communication. So I do like to hit home on that one. Anne, I'm going to let you take over here.
Thank you. So yeah, so a couple of things. We all know that the department is um, pretty overwhelmed with the number of certifications that are happening, both initial certifications and renewal certifications. And so to manage that over the last year and a half or so, what the provider certification team at the department has done is in some cases, they are doing an extension to your certification span. And you may not know that. And so one of the things, if you're like, man, I haven't gotten that 90-day notice telling me to start my application, my renewal application, you definitely want to log in and take a look at your current span. So while the current span is typically 3 years, the department has been extending those for maybe 90 days or whatever to help kind of get you into their workflow. That's because that doesn't become an option until you're within 90 days of that expiring. So definitely go in and check that if you think you should be getting a notice and you haven't gotten that notice. And then like Haida said, if you have started your application and you're getting to where you're within 30 days of that end date of your certification and it is still in a pending status, one of those different pending statuses is just not complete yet, absolutely use that communicate button and make sure you're saying to them, I submitted my application, I'm getting close to my renew or my end date, I'm within 30 days. Can you please consider extending my certification so that it does not expire? One thing to keep in mind with that is I will just tell you from personal experience of being the provider support person, we worked really hard to support providers through that process. But if you started your application 5 days before your certification end date, that team is not going to consider extending your certification. If you started it at, 75 to 90 days ahead of time, you were very timely in getting that process started, and you're still waiting, they are going to be more likely to then grant that extension. And honestly, I would say 98% of people who started it timely and requested extensions were being granted those extensions. So it is really, really important that you are kind of keeping track of, this is my 3 year span, this is the start date, this is the end date. Maybe put a reminder on your calendar that I should be getting that 90-day notice, and then go in and look. I didn't get one. Why didn't I? And make sure you're looking to see if that end date has been extended. Also, as Haida said, if your certification expires, services have to stop. So you've got to contact the county board. You've got to talk to your SSA. You've got to say, hey, my certification expired. Even if you're in the process of trying to work with the department to figure something out, if you don't get an extension and that date comes and you have not been renewed, you cannot provide services to them. If you've worked through the department, you've gotten that extension, and something happens with that
What happens
extension,
if I submit
then,
in 5 days?
pardon me, I'm sorry, did someone have a question? Okay.
You're good.
You with them too, because they will backdate you to that date of your extension. So again, it's all about communication. It's all about making sure that you are working directly with them, that you are timely in submitting that renewal, and that if something does happen, that your certification expires, even if you're still working with the department, that you are communicating with the county board and with the SSA to make sure that they're aware of that.
All right. Just pausing for questions here. I'm gonna.
We did add a link on this one here as well.
Oh,
The department's website on their provider page has at the top a number of user guides for the P&M system, the PSM system, the processes for certification, renewals, adding services, many different processes. So this is the link for the independent renewal user guide. Please keep in mind the department is working on accessibility on their website, and it is our understanding that some of these types of resources may be either going away or be moved to different places. So I would just recommend like go here and download it so you've got it when the time comes. Certainly, as soon as we know where these types of resources are going, we will make sure that we let you guys know where things have been moved and how that's been restructured. But it's there as of yesterday. It's supposed to be there through the end of April. But since you will need this sometime in the future, I would recommend going ahead and downloading that.
and we've got a couple of questions in the chat box, so I'll read them here. The
Okay.
first one is, do you mean to say if we have already submitted all required documents for certification, but if it's pending because they haven't reviewed it yet, is it our responsibility to ask for an extension?
Correct. That is what I'm saying. Um, I guess the word it's your responsibility probably isn't the right word. What I would say is that I would be cognizant if it were me to make sure that it is moving through that process, right? Um, so I would say that if I have a tickler on my file that says, hey, I am 30 days out and I am still in a pending status and no one has contacted me or talked to me about, extending that, then I'm making that contact with the department and saying, I'm a little bit concerned. It's still in a pending status. I want to make sure that I don't, my certification doesn't expire. I submitted everything timely. And again, like I just said, it's not a hard thing. There's a communicate button, and you are going to go directly to that person that's working on your application. Where if you call, you're getting a call center staff, which means it has to go through 3 or 4 different layers before it gets to the person who can actually answer. So that communicate button is definitely your friend when you need to talk to folks. So I think again, your responsibility, no, due diligence always goes a long way. And we all know how the system works. So just a reminder that you can do that. And I think that's a good practice.
The next question is what happens if they don't give you an extension and you're now past your renewal date?
Yeah, so it kind of depends on a number of factors. What is the reason that you didn't get an extension? You know, if you go past that renewal date and you have not received a new certification, you cannot continue to bill for services. And it doesn't matter if that's because the department has, tripped up on something, if you forgot to send something, or you forgot to do something. Medicaid at the federal level isn't looking at kind of who caused the bug in the system. They are looking at, were you a certified provider on this date? And if you weren't, you cannot bill. Now, my best suggestion to you is that first of all, you try everything you can through that communication button to have conversation. Don't wait till the end of the, again, 30 days, start having that reach out. But the department does have a provider support unit. That provider support unit is very, very good at advocating for the providers. I will tell you, again, having been part of that unit prior to my retirement, we weren't always everybody's best friend, right? Because we were going to provider certification saying, hey, we have a provider, something's going on, it's not moving through the process. What's going on? Why is, so I would say that if you are struggling to get what you need through the communication button, please reach out to the provider support person. On the DODD website, there is a regional teams link on the first page of the website. If you go to that regional, I think it might be the tab might say support team or regional support team. If you go to that, you'll find a map. Each county is interactive on that map. Click on your county and you'll get a drop down of all the different department subject matter experts for different areas. Go to provider support and find the person that's assigned to your county and then reach out to them and say, hey, I'm either very close to my or my end date. I asked for an extension. I haven't heard back. Or I asked for an extension. I'm now past my renewal date. I had to stop services. What can we do to fix it? And they are a great resource.
Yeah, for sure. Another question, I'll just kind of say it for the whole group is, I received my 90-day notice in February 10th. My renewal is due in May of 26. They completed and submitted everything on February 11th. Hey, good job. That's great. I'm still waiting on Medicaid to process my application. Do I need to file a request for an extension now or wait? My thought on it, and I wouldn't necessarily ask for the extension at this moment. It's still in process. And you have until May. I think the April-ish timeframe, I'm thinking like a 30-day timeframe of when you're getting close to it, because they are going to take 30 to 60 days to really even just get into it. That's just been our experience. But Anne, what are your thoughts?
Yeah, so I just want to clarify, Candy, if you can, you say you're still waiting on Medicaid to process your application. So I want to clarify, we are talking about the DODD certification and not the Medicaid application. So if you are talking about your Medicaid renewal, I don't know that. Well, I do know that the things we're talking about as far as the communication button, using the user guide, those are not about the Medicaid process. They are about the DODD process. So if it is the DODD process, then absolutely, again, I say that at that 30th day, let's say May 15th is your expiration date. You get to April 15th, you haven't seen any movement in it. They haven't asked for a supplemental. There's just not anything going on. I would hit that communicate button and say, again, hey, it's 30 days, just checking in, want to see if I can get an extension because I want to be prepared so that it doesn't end on May 15th. So I would use that 30 days as kind of a rule of thumb.
Mm-hmm. Yeah. Another question is, what if I submitted my research doc? It states it's under review, but under workflow, not complete. Did I forget to send something? So my quick answer on that is if it says that it's under review, that means it's being processed. If there's something that has been missed, like Ann said, you would get a notification for a supplemental application, and it'll say, hey, we need more information on this, that, or the other. So typically when it's under review, it's going through the process. It doesn't necessarily mean that it's hung up anywhere. You're just waiting for it to move through.
Will say that the system really has a pretty good communication function within it. So you should be getting emails about this is your status has changed, this is what we need, this is what's still pending. If you're not getting those communications, it's a red flag if you don't get that 90-day notice and you go ahead and start it because you're just diligently tracking your 90 days. I would be saying, why didn't I get an email, telling me it's time to start it? If you started it and you're not getting, hey, this was received and it's in this current status, if you're not getting those emails, you need to definitely double check and make sure that you have kept your contact information updated within the system, because all of those communications are going directly to whatever the current email information is that's in the system. So it's just important that you're tracking that as well. I just saw Brenda's comment. Brenda, I'm sorry that you went through that. I absolutely, know that there have been experiences that providers have had, where they've hit a spot where they expired, they couldn't get paid, and that it was really a challenge to get that worked out. Again, I can encourage you to be diligent and also reach out to that provider support team if you're not having any luck with the communicate button with the provider cert unit.
We've got a couple of other
Kelly,
items. Oh, yep. Go ahead, Ann. Yep.
I was just going to tell Kelly was asking about the link. You're going to get this, so you will actually be able to open the PowerPoint, go to the link. It's an active link, so you will get that as part of the follow-up to today's session.
We've got somebody asking about uh, resources for a new provider, certification for a new provider. I'm trying to find that question.
Where do we find this info for certification new provider? So again, if you go to dodd.ohio.gov, and at the top of the page, you will see different links. So one is supporting families. So if you're a family member, you would want to go there and find all the family stuff. One is called supporting providers. Click on supporting providers, and that will take you to a page that is specifically information and links for providers. On that page at the top is a kind of header or a banner that says user guides, and you click on it and you will get a whole link or a whole list of those. If you give me just a minute while we're kind of going around, I'll go to that page and I'll get the link to that page, and then you can go to that page and you can go through all those user guides.
All right, we're going to go ahead and move on to a couple more slides here while we get some links and other questions answered. So the next slide is regarding that Medicaid provider enrollment, or the ODM. And I know there was a question in here about, how do we do the ODM one versus the DODD? So I'll just kind of touch on that here, and then Anne, if we have any other resources, we can always add to our slideshow before we send it out, or send out additional resources with our materials as we get your guys' comments. So we do really appreciate it. So with the ODM piece, independent providers must be enrolled with the Ohio Department of Medicaid. That revalidation is required every 5 years. Provider information must stay updated, and billing cannot occur without active enrollment. That kind of goes all along with the different things that Anne had spoke about. So let's see here. The next one is, just talking about that training and the training that's required as an independent provider. So we went ahead and we've got the link here for you under My Learning. And I went ahead and put a little snapshot in there so you guys kind of see what the screen looks like once you get there. You're for the annual training. So again, if you're new, if you're getting certified, you would have in the initial training. I'm kind of pointing you in the direction of your annual training that you've already been certified, and here's the training that you need to do on an annual basis. And so this is what, as of right now, this is what the screen looks like on My Learning for that annual training. And so we kind of broke out here some of that information. So each year, as an independent provider, you would complete 2 hours of training provided by DODD or utilizing DODD to approve curriculum. And I do know that some county boards offer that training. You might have other resources where you can go get that training. But if you're not going to get it in person, you want to utilize the My Learning training. And the trainings in that session include topics under empathy-based care, DSP Code of Ethics, rights of individuals, and health and welfare alerts and safety updates. We also have a link in here. Anne, do you want to talk about what it looks like the link is taking us to? Oh, this is probably to provider certification, the appendix that's specific to the requirements for independent providers. So this is a separate document. And then we also have that as a document. We have it a resource that we're going to send to you too, that kind of just breaks out what the provider certification rule says regarding the required training for independent providers. So you'll have that as a handy document as well. All right, so additionally, and again, this is part of that document and the link that we have there, is that independent providers must also complete 6 hours of training each year in topics related to the services that you provide. So you can choose the trainings that are most helpful to you and to the individuals that you support. The way that the provider certification rule breaks it is into 3 kind of overarching categories that the trainings have information from either quality care, health and safety, or positive behavior support. And so we kind of put in the link or the points under each of those items, or some suggestions, if you will. So under quality care, you have building trust and relationships. It could be effective communication, cultural awareness, person-centered planning, implementing the OISP, or trauma-informed care. Under health and safety, it could be recognizing signs of illness or injury, how to respond to medical concerns, transportation safety, preventing accidents or injuries. And then under positive behavior supports, supporting individuals in a positive way, understanding behavior support strategies, proper documentation of behavioral supports, or responding to crisis situations safely. So again, it's 6 hours of training in totality of topics that are specific to the services that you're providing or who you're supporting, and then under these different categories. Anne, did you want to have anything here to talk on about training?
No, just again, there's a lot of different places where you can access training. So you certainly should and could access what's available in My Learning. It's completely free. You can also access training from county boards or different groups like 19 Services, etc., that offer those trainings. It's just super important, though, that you make sure that any training you're taking that you want to apply to the required training, that they are provided in a manner that is consistent with the requirements of the department. There are a lot of people out there, especially on social media, that are offering trainings. And so these trainings need to fit into the DODD requirements, the curriculum that DODD has put out for certain trainings. So it's just, again, important for you to make sure that you are getting your training from a reputable source, because there are so many people out there that are offering these trainings.
Candy has her hand raised. Candy, go ahead.
So I just want to confirm, I have been told 2 different things, but someone has told me that if you take the annual training through the county, that which is 8 hours, that covers your 2 and your 6 completely. You don't need to take, I mean, you're welcome to take other classes, but that it covers all total 8, the 6 and the 2. Is that correct?
So each county is different. They don't all provide the exact same training. So it really is important for you to talk with whatever county board you're working with, to make sure that what they are offering, even though it has a total of 8 hours, right? Is it the right content? Is it the right topics? So every county board is different. There are some county boards that are like, well, the only one we offer is, the MUI training. We don't offer any other training. So if you've got a county board that's offering an 8-hour curriculum, first of all, kudos to that county board because they don't all do that. But also just make sure that you're talking to whoever that trainer is to say, hey, I just want to make sure like this is going to meet all of those 8-hour requirements.
Yeah. Yeah.
Thank you.
Yeah,
Mhm.
thanks, Candy. That's a great question. We've got a couple questions here. We'll just address it together with health and safety alerts and what the requirement is around that. So, my thoughts on health and safety alerts is we have to be able to prove that we've reviewed the previous year's health and safety alerts. So, however, I'm seeing someone say you don't have to print them or keep them. One thing to also consider is that My Learning has a health and safety alert module in it that you can go in and review all of the previous year's health and safety alerts at the same time, if you will, and you would get a certificate for that. And Anne, I don't know if you have any other insight on it, but I always just want to make sure, like, whether we're printing it, whether we're doing this or whether we're doing that, we have to be able to show that we reviewed the previous year's health and welfare alerts. So I don't know, Anne, if you've got insight on that one.
Yeah, so my insight is it doesn't matter if it's DODD, it doesn't matter if it's the Department of Aging, doesn't matter if it's the Department of Health. When you have 25, 30, 40 reviewers out there doing work, and then in DODD world, we also know that we also delegate that authority to the county boards, right? So you have literally hundreds of reviewers who are out there doing this work. And as hard as everyone tries for consistency, you are going to have one reviewer who's going to come out and you're going to say, I looked at every health and welfare alert. I wrote a note in my calendar that today I did it. And they're going to be like, oh, that's great. And you're going to have another reviewer who's going to come out and who's going to say, you're going to show them that calendar and you're going to say, I wrote, on March 15th, I reviewed all health and safety alerts. And they're going to say, no, I need to see each one so that we can verify that you actually read it. So unfortunately, that is just the nature of the compliance beast, no matter what type of system you're in. My recommendation for best practice is that it's pretty simple to print off the health and safety alert when it comes via email, sign your name and date it at the bottom and put that in a folder and have that to be able to say, here's the date I print and read this, or do them all at one time when the same time you're doing your MUI training that year and print them all out and put them in a folder with your MUI training. Said I did county board MUI training this date. And on that date, I went home and read all the alerts that date. So I always say that over verification is better, but I also know you all have a lot on your plates and it's difficult. But it is hard because the guidance is on the tool. And even with that guidance, different reviewers, different surveyors are going to ask for different things.
Mm-hmm. For sure. I know we've got a question saying what county is Network 19 speaking on. So Network 19, we're here to support providers across the state of Ohio. So we're not speaking on behalf of any particular county. I think there was in the chat, there were some people talking about maybe what counties they had been working with. So we highly recommend that, you reach out to the county that you're in, to check and see if, like Anne said, if they have special trainings or different things, that they're meeting the requirements. All right.
Keisha shared something in chat that I think is a really great point for folks. If you also happen to work for an agency and you're an independent provider, the training that you take through your agency, as long as it is the training that meets the requirements, can be utilized to meet your independent provider requirements as well. You don't have to take the same training twice just because you're a DSP through an agency and an independent provider.
For sure. All right, I'm going to go ahead and move on some more slides, and I'll let you flip through the chat for a second. All right, so just wanting to touch on those additional training requirements with your first aid CPR. And this is taken directly out of the rule. Sometimes it's easier to be able to talk about it like this is what the rule is saying regarding first aid CPR. That you have American Red Cross or equivalent certification in first aid and CPR. And a reminder that the CPR, it has to include the in-person skills check. And sometimes that can get a little bit wonky. We've seen online certification where you can go on. There's all kinds of CPR online and, Heart Saver, different things. You can do the American Red Cross. They have an online version as well. But if there's online piece of it, there has to be the in-person skills check. And so we always recommend, if you're going to do it, just go get your classes in person. Make sure it's first aid and CPR. Sometimes, you might see a certification that's CPR only or first aid only, that we make sure we have all of those components, as well as the in-person skills assessment for the CPR. Service rule. Oh, I'm going to stop here for just a second because we're going to move out of the training conversation for a moment and see if you guys have any other questions there. You can always put them in the chat and we'll keep answering them. Again, we'll have that document and the link for you that kind of holds those training requirements as a standalone item. So, all right. Just keeping us on track here. All right, so service rule responsibilities. Independent providers must follow the rule for the services they deliver. So making sure that that includes implementing the ISP or the Ohio ISP, delivering services as authorized. So as authorized through the county board, the SSA, following service settings requirements and maintaining documentation. I know we had a question in here about some documentation. So we'll get there to your question. Other additional ongoing compliance requirements is, making sure your documentation. We kind of touched on this our last Network 19. And if you guys, I think we had talked about it, and if you're interested, we'd be more than happy to have another Network 19 that's kind of specific to documentation and requirements. But making sure that what you're documenting on houses all of the required elements, that it's tied back directly to the ISP, and that it matches your billing. Incident reporting, so making sure you're reporting incidents, MUIs or UIs as needed, that you're meeting those timelines of your incident reports or reporting if you need to report to the county board. If it's an MUI, making sure you have those timelines in place. Plan implementation, so following the ISP, communicating with the SSA if there's issues. Sometimes we come across an OISP and maybe the information that's in there under the outcomes or under the services and supports, maybe they don't align with where we're at currently for the individual. And so making sure you're communicating with the SSA of saying, hey, we might need to have a team meeting, a conversation about the ISP. These services and supports aren't lining up with where the individual's currently at, because we want to make sure that what we're providing is in alignment with the plan. And then service delivery standards. So there's service specific rule requirements, and we have a link in here for the rules section for the Ohio Department of DD. So that link will be there. Anne, did you want to talk on any of these items?
I think probably the big thing in here, especially for our independent providers, is really that plan implementation, right? I think that sometimes it's challenging, and I've been in this system for a long time. I have worked in the field for over 35 years. And so I still get kind of hung up on those kind of skill building elements of the service plan versus those outcomes that are in the service plan. So I just can't emphasize enough, when you are implementing that plan, from the very beginning, if you look at it and you have questions, make sure that you're reaching out and communicating with the SSA. We talked earlier in our agency group about building the foundation, right? And so I think when it comes to service delivery for independent providers, the real foundation of what you do is understanding and following that plan and making sure that you are documenting what you're doing correctly. So don't wait for a review to find out that you're not documenting outcomes correctly. If you're not sure when you get that plan, please make sure that you are reaching out and communicating with the SSA to say, look, I need some guidance on making sure that I am documenting correctly what the team was expecting from me, what the person was expecting from me. And that will go a long way in making sure that then when that compliance review comes up. So that's probably for independent providers. What I would say is the number one thing in making sure that you are starting off on the right foot with services when you're starting to serve someone.
Mm-hmm. Janet has a good question in here. It says, is it a rule per DODD or Medicaid that a client is required to have an outcome? And I've got a couple of thoughts on that, but Anne, what are your
Go ahead.
thoughts there?
Go ahead. Go ahead. I
So
will refer to you.
the way I would answer that is that the rule doesn't specifically say outcome, but what the concept is that each individual should have an outcome. However, that doesn't mean that the outcome is going to be assigned to every single provider that the individual is working with. So the individual might have an outcome for getting a job or going on vacation. And so that specific outcome might not be relevant to particular providers that the individual has in their circle of support. And so sometimes there's a lot of different conversation around about that, but the way, we tend to look at it is yes on the outcome. However, the experiences or action steps might be assigned to one provider. It might actually be assigned to the individual themselves, or it might be assigned to multiple providers based on what that outcome and where we're headed. And so those are kind of the words I would say on that answer. So it's kind of long, which is why it was easier to talk about on here versus type it out. Okay. All right, let's move on here to our common compliance mistakes. And talked about this a little bit too with documentation. So, and a lot of our chat, right, has also been about that certification and the renewals, making sure that we stay on top of those timelines. I think we had somebody asking if their renewal, if you could start your renewal process 90 day, like before the 90-day mark. And I'm pretty sure you commented on that. Like, we can't do that, right? We have to wait until we get our notification to go in and start the renewal process. Now, you guys can have your stuff gathered behind the scenes, right? Like we've got to submit the same kind of items every time. So like having your items handy, your trainings, your first aid CPR cards, like your driver's license, or all of those things, you have those kind of ready to go. You can do that preparation on your own. But as far as the actual process, we can't start it until we get that notification. And being prepared for a review, again, and I did see folks saying they would like to have a session on documentation and requirements. So, we'll definitely put that on the books, because a lot of your preparation for your compliance review is regarding the documentation, whether it's service documentation, whether it's incident reports, or if you're doing medication, all of those items. So we put a couple links here for you. Staying organized helps avoid these issues. So we've got the compliance review tool specific for the independent providers. This is the most current review tool. Just know that those do typically change 1 to 2 times a year. And then the required documents list. So your required documents list is based on the compliance tool, and it's going to kind of walk you through step by step. When I go for my review, here's the items that I need to bring with me. And so those are always helpful to have and kind of look through, especially before you get your review notification. So you'll have those links in there to be able to directly go find those items. And did you have any other pieces there?
No, there was somebody that was asking some questions regarding outcome documentation, and if you'll bear with me, I am actually trying to find the link to those templates. So if I can find those, I will put that in chat for the folks that were talking about that.
Yeah, and we have those templates as PDFs. We can also do that as well. So Ann will put the link in, and then we'll put as part of our attachments to you guys the actual PDF versions.
Thank you.
We'll do the outcomes documentation, we'll do the services and supports, and we'll toss in the HPC transportation. Those are all the DODD templates, right? So we understand people might have different pieces, or maybe your county board is helping with that, but we'll provide you with the templates from the department, and we can go from there.
It actually looks like they've been removed from the compliance provider resources page. So I'm not sure why, but that's where they used to be.
Okay. All right. Well, we'll get you guys those templates in the email that we send out with everything. All right, so where to track everything. So DODD My Learning does track the trainings that you take in there. It's always helpful because you can print off your transcript. You can have that available. Um, the Ohio Medicaid Provider Portal, different provider notices, and different county board communications. So, and then along too, like with Network 19, like there'll be different pieces and parts that we're sending along to you guys, and maybe finding a hub, whether you have it on your computer or somewhere that you can store the different information that you have. It's kind of like with your certification documents, making sure you have a place digitally to have those items. So, how do we take our driver's license, to copy it, to scan it, to put it into maybe a folder on our computer, and maybe having a folder labeled, certification documents or training documents. So that way you have a place. We live in a very digital world, and I know
15
that
minutes.
can be sometimes tough, but having those resources, or having people that that can maybe
In
help
the
you
garage.
digitalize
Oh,
some
just use
of
the vacuum
your
cleaner.
items, that's always helpful too. Because I understand you might not have, a large copier and different things, but how can we, help or find someone who can help make those items digital for us? All right. Okay. Some of the key takeaways, we still have some other questions coming in here. So key takeaways, to stay compliant as an independent provider, we want to keep our certification active. We want to maintain our Medicaid enrollment, complete required trainings, track background check dates. So that's based on when you originally sent it in with your certification, and then document our services accurately. So those are kind of all of our overarching items for keeping our certification and ourselves in compliance. All right, Anne, I'm going to let you maybe look through the comments if there's any items that we want to talk about with everyone. We got about 10 minutes left. Also, if anybody has a question, you're welcome to come off mute.
So just looking here through a few things. So someone is asking, can we still use our own HPC and transportation document sheets? Yes. So the templates that are available are suggestions. They give you a format that includes all of the required elements, but the department has not made them required. So they're just to let you maybe compare yours to it to make sure that you have everything, but yours are absolutely fine. Again, just ensuring that they require all or include all of those required documents. Some folks, thank you all so much. The purpose of Network 19 and the reason that this got started was that for a long time, for about 4 years, 3.5 years, DODD had a social media space that was dedicated to bringing providers together to talk about, well, right up here, the Facebook forum, the provider forum. And that went away in December. And so there was so much good that came out of people connecting and networking that Network 19 did not want to see that go away. And so that's why we created not only the social media space, but also these sessions. While we are more than willing and want to continue to share with you resources and information, what I see in chat is really what this is all about. And that is people getting together saying, here's what I have, here's how I do this, here's a tool that or a resource that I've used. So I want to thank you all for the robust conversation in chat that includes sharing those other resources and tools that are out there. So appreciate that. Sorry, you guys are moving faster than my computer can keep up. Let's see. Someone's asking about CEUs for today. Yes. And again, when you will get an email that will include a bunch of different things. And that will also include the CEU information. How long shall we keep documents in our binder? So there's a couple of different rules out there, and there's always been a little bit of a varying opinion. There's one Medicaid rule out there that references 6 years. There's another one out there that references 7 years. And so best practice has been 7 years or to the date of your last Medicaid review. So keep in mind, DODD coming out and doing your review is a DODD review. But if by some chance the Ohio Department of Medicaid or even CMS, Center for Medicaid and Medicare Services from the federal government were to come to Ohio and do a review, it's up to the last time that they did a review. So we recommend 7 because there is 2 different federal guidelines out there. One is 6 and one is 7, but that would be our recommendation. I think that's it. I think the rest of the questions we've answered about training certificates, copies of this, etc. So I don't see
We had a question that I'm not, we might need a little bit more information on it from Deborah about, can you explain why the state went from 60 hours a week to 40 hours a week?
So that's about the independent providers overtime.
Okay, right. Okay. I don't know if we want to talk through that one.
It wasn't something I prepared for today's conversation. I think it's certainly something that we can put on our list of topics and things to maybe talk about in an upcoming one. What I can tell you just very generically is that the rule has not changed. The rule still, to my knowledge, as of last week, still allowed the ability for up to 60 hours. I think what has changed is that during COVID and things like that, there was a real need for more hours. There were people picking up more hours because there weren't enough staff were off sick, et cetera, right? So that flexibility of up to 60 hours was really useful during that period of time. And I'm not saying it's not useful now, but I'm saying that prior to COVID, there was a requirement or an expectation that if someone was going to go into overtime, it was done because all other resources had really been looked at and considered. And, was there the availability of multiple providers so that no one went into overtime? Was there availability of natural supports that were unpaid, a family friend, a sister, a brother, whatever? Was there the ability to utilize other services? So during the summer, could a child who's not in school go into a summer camp program so that their provider didn't need to provide? So all those things were part of kind of the regular assessment prior to COVID. And I think what the department is doing is really trying to kind of move the pendulum back a little bit so that county boards and teams and SSAs are really truly assessing again that need for overtime. And so I think that's what you're seeing. And like every time a change is made, people will often paint it with a broad stroke. So I have heard, people saying county such and such said they're not approving any overtime. And then another county is maybe following the process the way it should be, which is assessing. And sometimes there is a need for more than 40 hours. So I think you have that gamut going on. And I think because it's kind of a new emphasis over the last month or so around this, county boards are trying to work out what that looks like. So that's what I know at this point. We will continue to kind of watch that conversation and dialogue and see if anything very specific as far as guidance comes out. But right now, my understanding, the guidance has been to get back to that process or work to get back to that process of truly assessing the availability of alternative services, additional providers, and other things that would limit the amount of overtime that's truly necessary. So if anybody else knows anything else, or feel free to share, but that's been what I've gathered over the last month or so. And now we have 15 new questions or comments.
I did see a question earlier back about being newly certified, struggling to get started beyond the provider search tool or their local meetings, trainings, etc. My thoughts there would be kind of what Ann had spoke about earlier with, trying to connect with your local provider liaison at the county board or within the COG that you're in. Ann, I don't know if you have any more to say on that one.
No, I think it's similar to, like you said, things we've already talked about. Sorry, I was also scrolling, so
Yeah, I'm looking
I'm
as
trying
well.
to multitask, so I apologize. Let's see. I know I put
Go ahead.
I was just gonna say, I know I put several links in here. Again, we will try to make sure that anything that we shared, we include in our packet that will come out to you guys. Somebody was asking about the emails that they're getting. There's one about review and update your provider enrollment records in the P&M network. So what's really difficult and challenging, right, is I always called it's like stacked certification. And so for waiver providers, you've got multiple entities that you are certified by, right? So you've got the Department of Medicaid, then you have DODD, and then the county might have some things that they ask you to do. And then depending upon which service you're doing, there might be some additional things that you get information and communications on. So it is not simple to kind of keep your, like, what applies to me, what doesn't apply to me. I will tell you that after multiple conversations with the Ohio Department of Medicaid, who is the one who's sending out these PNM updates, right? They view every provider, regardless of whether they're providing through the DODD system, the Department of Aging system. They don't distinguish you guys any different. You're getting the same notices that a doctor gets, because if that doctor is billing Medicaid, they're a certified Medicaid provider. So while I know it's challenging, I don't see anything coming down the pike from ODM that's going to make it easier to distinguish. Specifically, the one she's talking about is the one that comes out regularly about keeping your information updated in PNM. If you don't need to make any changes, there really is nothing that you need to do. But again, if you don't keep that updated, here's what happens, especially for our independent providers who might go a few months without providing services, right? If you're not actively currently providing, it might take you a while to get selected by someone. So you might not be billing for 6 months or 9 months before someone selects you. And if you go a certain amount of time without billing, Medicaid assumes that you no longer want to be certified, and they're going to send a notice out telling you that they're going to cancel your certification. If you don't have your records up to date and your contact information up to date, you're not going to see that where you can respond and say, no, 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 I am still interested. I don't want my certification to be taken away. I'm just waiting to be, for someone to choose me as a provider. So I think those monthly reminders really were meant to keep those things from happening, because the system is really built upon a lot of things automatically happening. So we've gone over, and I apologize. There's always such good dialogue. We will run through here and see if there's anything that we completely missed. And if we did, we'll try to address that in our email that's going to come out with the packet. Otherwise, we want to respect your time and let you get back to all the important work that you're doing. We appreciate you very much. And I'm excited to be a part of 19 Services and the Network 19 program. So hopefully we will.
Well, thank you all so much for joining us today. We really appreciate it. And yes, keep looking at your chat. We put some additional links in there, answered a couple of other questions. So we really appreciate all the insight and input. All right.
Thanks, everyone.
Thank you all. Have a great rest of your day.
All righty. Bye-bye.